Good morning, everyone. I'm Petra Bogart. I am the coordinator for the PHIRI project. Welcome, everyone, for being here today. Today is all about showing what we've done so far with PHIRI. We started in November 2021. So now we've run halfway our project, and we're really proud for all the things we've done. It has been challenging, I would say, with COVID, having to deal with virtual meetings for such a long time. But today we're very pleased because we have some of our colleagues here around the table. So that's a real pleasure to be able to see each other live. And of course, those who are not live, we are very happy you're joining virtually. So today what we will be showing, we'll have an introduction by our scientific director, Karin de Ridder, who is here with us today. And then we will have a short video showcasing all the different activities we've done in very brief. And then we'll go a little bit more into details. So we will have our various colleagues presenting, representing the different work packages, showing our activities. So I think some of the important things we've achieved so far is we have set up a health information portal, which basically is a metadata catalog for population health information resources across Europe. We have built a very strong rapid exchange forum, which provides exchange on knowledge and expertise all across Europe, and has provided fruitful answers for policymakers and researchers across Europe. We have been working on PHIRI use cases, which has a dual role, both answering important COVID-19 research questions, also looking at the wider impact of COVID-19, and at the same time testing and implementing federated data analysis. So having the data not move from the organizations where the data is hosted, but to be able to address a research question centrally. Of course, we've also had some other important activities we've done. We are working on systematic review to look at indicators, to look at the wider impact of COVID-19, and we have been working on foresight modeling and scenario building. And last but not least, we are going into 11 countries to assess the COVID-19 health information system, because now is a good time to take a step back and see how we can make our health information systems more resilient. And of course, throughout all our activities, capacity building has been core, because we really believe in order to address inequalities between countries, it is important to also strengthen the capacities and the knowledge we have in the countries across Europe. So that being said, my colleagues will give much more information on all of these activities that we've been doing. Today we'll be focusing on our achievements, but before that, I would like to pass the floor to our scientific director, Karin de Ridder. Thank you so much.
Thank you, Petronil. Now you already said a few things I had to say, so I can keep it short. This project is for me a very important project in the European field of creating health information infrastructures. And like you said, it has been a hard time for many of us to try to run a project in these conditions with a lot of online meetings and online organizations. In the same time, while we see in the European field that there is a change in demand towards population health information instructions with the European health data space evolutions and so on. So I think this very important work, because you see now that there is a transition from think conceptual and not having everybody really understanding what this is all about. And with this project, I really have the feeling that it's a transition from conception towards instrumentalization. And that's a very important exercise to find out together with all the European partners to see what is possible and to try out and to find solutions. So therefore, I think it's a very important project. Not only that, the COVID-19 has also emphasized the role of the public health institutions and the ministries to deliver and provide information and knowledge to those policymakers and also the general public. And we know that a little country like Belgium or other separate countries, we not always have our own answers and our own solutions. So through this building of this network, it has been shown that it's possible to also have this rapid exchange of information throughout your forums and by the creation of portals to try to find solutions together. So the PHIRI facilitates the identification and the access and the assessment and reuse of population health data, not only for the current research questions, but also for future research questions if we think about long COVID and so on. So although there was a very heavy workload and many other demands in all those institutions and ministries related to COVID, the PHIRI until now, only halfway, I think, has already achieved quite a lot. Like you say, it's very good to have this health portal where you have these different data catalogs with different projects on it, with building this network, but also providing this training and material and courses to other countries, because it's not only having this information available, it's also what to do with it. If we think about the foresight and trying to use this information to think towards the future, it's a very important exercise, and it's very good to see that there are 8 countries going further, not only from course, but also trying to implement this information. So that's very positive, I would call it. And I know you have been very busy with all these country assessments, but I think if we can learn the best from each country and we can try to combine it in the future in this project further on, but also in future projects that are launched or shall be launched, I think we can make further progress together with all our partners. So I will have to leave you because I have another important meeting, and I hope you're recording some of the presentations. I don't know if it's foreseen, because it's very interesting to hear also about implementing this federated structures and how to see how we can combine these data, which we not easily can exchange, but if we have ways to access them, that would be very good also in the future. So I wish you a very informative meeting, and I will for sure see other partners in the future also. Thank you very much.
Thank you so much, Karin. It was a real pleasure having you here, and good luck with the very busy schedule. All right, so we will move on from that, and then I will happily be showcasing you the PHIRI roadshow. Great, thank you so much. I think a big thanks to Bartholomew, our communication colleague, has been working very hard. So thank you so much for this great video. Of course, we will post it on our PHIRI website and our social media. Feel free to share it. Please do share it in your networks. I think it's a nice summary with the facts and figures of what we've been doing in the past year and a half. Now we will go and give a bit of time to explain a bit more in detail what each of these different activities mean and what we've achieved. We are in a meeting which is a WebEx event, which means that attendees can take the floor immediately, but of course this is also meant to be interactive. So if you have any questions, put them in the chat, and then we can stage you and we can make sure that you can ask your question also live, so that our colleagues around the table and virtually present can also answer them. So don't hesitate to put your questions in the chat, and then my colleagues will try to make sure to find you and give you the floor. So our first topic is the Health Information Portal. We've put a lot of work in this, and we started already with this Health Information Portal concept within actually our previous project, the Joint Action on Health Information. And COVID-19 has really showed also the importance of being able to find data, to be able to share data across Europe. So I will pass the floor now to Hanna Talona from the Finnish Institute for Health and Welfare, who's leading the work on the Health Information Portal. Thank you.
Thank you, Petronella. And also welcome on my behalf. Just briefly telling what's the latest developments on the Health Information Portal. So as you know, the Health Information Portal can be found online. Been there almost a year, a couple of days to go for that. And what's the, What's the Health Information Portal? So it's planned to be a centralized one-stop shop for the researchers and policymakers to find the information on health. And now we mean the health in broader perspective, not only the clinical information. It aims to enhance secondary use of health information in general, and it uses the standardized metadata formats for the cataloging the information, and through that supporting the FAIR principles and interoperability with these other similar activities and portals in Europe. So what we have been doing since the launch at the end of May 2021, we have added information on new national nodes. We have published the capacity building section on the portal. We have published the COVID section on the portal. And now we are celebrating the 1-year anniversary of the portal to promote the information, extent of the information we have been gathering there. Next, I will go through these latest developments in a little bit more detail. So national nodes are the organizational entries. They are the collection of the national actors on the health information, coordinated by one of the key actors, quite often the National Public Health Institute within the country. They are the key partners within the Health Information Portal, because through them we will be gathering, have been gathering and will be gathering the information to be presented on the portal. They are the experts of their national information, and because of that, their role is important. They are the only ones who actually know what's happening within the country. Lately, we've been adding the new information, extending the available information on the data sources, publications, and so forth for the national nodes. Other big development has been on the health information sources. Our original health information source template included only 7 elements. Really basic elements telling what kind of data different countries have. But now we've been extending that, and our current template includes 38 elements, so it's quite much more detailed information we have been gathering on the health information sources within the countries. So there's the general overview, information on demographics, more details on the data sets, how to get the access to the data sets, and contact information for the data owners within the countries. So that makes the usability of the information on health information sources much better than previously. Just to demonstrate how it looks on the portal, there are 4 tabs, so that overview and general information providing on the data set. Then we have the demographics, and I just realized that data set information on my demonstration slide is missing, so sorry for that, but please go to the portal to see how it actually looks there, and then there is the contact information. And that's good reason for you to go to the portal that I missed it on my slides. So for the capacity building activities, that was the new module we launched approximately 6 months ago on the portal. And there's a catalog of the available training activities in Europe and further on the world. Not only related to the COVID, mainly focusing on the COVID, but also on the other health information topics. And then we have the European Health Information School activities listed on the portal. So there's a catalog of those capacity building activities, and through our search function you can look for the topics, countries, where the capacity building activities are on the catalog and get more detail. Similar for the European School of Health Information, there's a listing of the activities by year, and clicking the special activity you will get more information on the activity. There are both upcoming and past events, because for the past events there's quite often also information, recordings, slides available through the links, so you can access the material through the portal as well. One of the sections we are very proud is the COVID section. That's something topical at the moment, been for the past 2 years, to have a lot of information on the COVID-19. We have a list of policy measures taken within the countries on the COVID-19, but also we have the minutes of the past rapid exchange forums posted on the portal. For the policy measures, you can do the searching either by country, which then lists you what kind of measures a specific country has taken, and there's always information when the information was updated, so there's a date available, and nice color coding telling does the country has the measure in place or not. Alternatively, you can search also for the specific measures to see which countries have that taken, and the map shows you quite good overview with one glance what's happening at the European level. And then for the rapid exchange forum, which Claudia is talking more after me, the minutes are posted also on our health information portal for your information. What's happening next with the portal? As all portals, it's never ready. It's always under development and improvement. So we will be extending the information on the health information sources for the countries. That's under progress, and obviously adding the new ones when needed. Same goes with the health information studies and research projects. That's the information we've been gathering, and that will be uploaded to the portal shortly. More capacity building activities will be searched for the future and added to the portal, and highlighting the activities under European School of Health Information. Publications from the national notes, which also actually includes the grey literature, which is really important since that's usually quite difficult to find, will be updated and added through the national notes. COVID section is something that we have the rapid exchange forum meetings every 2 weeks, and minutes will be updated there as well, the information on the policy measures. And obviously search function is something, it's never perfect, so we will keep improving that, and hope also your feedback if you find something that could be improved on the portal. Don't hesitate to contact us and give feedback, because that's the only way to make it more user-friendly. Thank you.
Wonderful. Thank you so much, Hannah. So yes, indeed. I was just saying also yesterday that we were speaking to someone who had developed an amazing software program to follow up on COVID in Portugal. And one of the statements he made is, you don't need to wait for something to be perfect before to start using it. And I think for the health information portal, that really counts. We're constantly improving it and constantly making updates so that it's more user-friendly. But a lot of information is there that is very useful. This includes information on, indeed, the COVID-19 measures, capacity building, and lots of other areas as well. And I think what's important is we're not doing that on our own. So we're really working together through a bottom-up approach. So who is actually filling this health information portal? It's people in the field working in public health institutes, in ministries of health. And so we're very grateful for them, because it's a lot of work to provide information that's on there. So I also want to give a shout out to them today for having provided us all this information and still keeping it up to date. And I think this will be quite important. So besides our partners within the countries, of course, we also work together, for example, with the ECDC. They also have a measures page, and we will be collaborating because the way they're collecting information is more by searching websites, for example. So I think the information we have here is quite unique. And also for the capacity building page, for example, we're collaborating closely with ECDC and with other international organizations that are providing training, but also other research infrastructures, for example. Yeah, so that being said, let's move to the next topic, which is the Rapid Exchange Forum. And I will pass the floor to Claudia Habel from the Goethe Institute, Gesundheit Österreich Institute in Austria. Okay.
Thank you so much for giving me the opportunity to talk a bit about the Rapid Exchange Forum, which is, we're really all very proud of it, that we made it happen, that we, sorry, it's the wrong presentation actually.
No worry, okay, we can switch it.
Please, I talk in the meantime.
Yes.
You know, we started with this Rapid Exchange Forum already a bit before the official start, because there was a need for an exchange on various topics, policy related to the corona crisis. You know, there were a lot of, we didn't have too much tools in our hands. There were no vaccinations, there were no medicinal therapies. We didn't even know, there was no evidence or really diverse evidence on what could help us to protect our citizens. Because people like myself and a lot of them who are working on this project are related to the crisis response teams in the countries. You know, we are not the first row, perhaps not even the second, but we are definitely the third row. So the ones preparing the evidence, trying to find guidance, and those advising policymakers perhaps which way to go further on. What we did, we offer a platform which is really taking place regularly, which is targeted at actors from mainly public bodies, competent authorities, universities, advisors of policymakers, and of course, policymakers themselves. We do an exchange of best practices among countries, mainly focusing on COVID-19 so far, but perhaps we will be expanding the scope of these meetings that should take regularly place also in future, every second week. You have to click, please, for me it's not working. Next one, yes. So we have bi-weekly meetings every second Monday, 10 o'clock. It's 1 hour. You're really welcome to join us. You can, somebody will write in the chat, please, our address, phiri.austria@goethe.at. Just drop us a message and you will be added to the list. And then you can have a first look and you decide for yourself For example, the next meeting will take place on upcoming Monday, 10 o'clock again, it's the 11th of April. The topic will be evaluation of the COVID-19. So what did we do good and what did we perhaps not do so good in other countries? Next slide. It was already mentioned, we have plenty of activities. We have 28 countries attending, not all the times, but very regularly. There have been 32 meetings already. There are 5 special editions, so including a lot of stakeholders, like the mentioned PHIRI cluster people. And we had a number of conferences already, and we'll have some more. Next. So what do we do? We do a collection and mapping exercise of experts in the field by thematic fields. So on water, hygiene, and long COVID, and whoever. So you're welcome to address us if you want to reach us to some specific experts. And we are, of course, also happy to list you in our address book in case you want to share your expertise with partners in Europe. We collect policy and impact measures, guidelines, initiatives, project information sources, mostly related to the COVID-19 pandemic in EU member states. Of course, this is a big group behind it, and I'd like to mention at least our task leaders, which are Professor Luis Lopao of the Universidad Nova de Lisbon. I think he will speak later on. Then we have Luigi Palmieri and Brigitte Umit of the Italian ISS, Istituto Superiore d'Italia, the Public Health Institute there. Then we have Robert Lang, especially from the Hungarian OFCO. We have Neville Kalecha and his team from the Maltese Ministry of Health. And of course, we have all the San Sanos colleagues who are attending every time. You know, so the beauty about it is that not all of us have to search for the most relevant new guidance that was perhaps issued by OECD or WHO just yesterday. But we have partners doing this and sharing with everyone. And that's why it's important to put it also on the self-information portal. Hannah mentioned before, so it's also for you, for the whole community, for the scientific community, public health advisors, who can have access to this information. We are quite in a good routine, so meaning on Monday we have the meeting, on first the latest we have all the information updated with this more than 80 questions. So there's 2 pages again on the website. It's on the health information portal. On the policy measures, you can find information per country, more overarching. And if you go to the Rapid Exchange Forum site, you will find all the details. For most countries allowed to share this information, which is really a great pleasure for all of us. Next one, please. Well, these are a couple of topics we covered in all these questions. We cannot put all there, but some are repeating, discussed about the vaccination strategies very often, or the question of certificates, how to use them, about the fake certificates. Really, we had pictures. How can we identify a fake certificate? So people showed wrong ones and right ones, and we had to say which is the good one and which is the bad one. This was quite a challenge, believe me. And you see it already on the screen. We are already preparing one of the upcoming topics for winter 2020, because we're so sad to say, but most of us think there will be another wave. Next slide. Well, I think this was shown already. Just this is the example of this health information portal. As Hannah said, don't hesitate to check it out. We will also cooperate with ECDC. We're fully aware that others have such response measures websites as well, but we are working on linking our efforts, reducing the burden for everyone and having even better and more accurate information. And it's up to you. You're welcome to join us and help us to do that. So if you would like to provide information for your country, don't hesitate to reach out to us. Next one. I come almost to an end. This is another couple of examples. You see, all the countries participating have the right or are even encouraged to share their questions with us. And then they are most likely to be answered quickly. Even if we have only bi-weekly meetings, if it's really, really urgent, we also have a mechanism. So countries send out a question, and we from the Secretariat will make sure that at least 7 or 8 answers will be there within 1 or 2 days. this is working quite well. And you know, it was quite heated phases we had, decisions had to be taken, and everybody was really nervous about something. So this was really a good instrument where you could address likewise people. Next one. Slowly coming to the end. You know, this is just an outlook what we plan, and I really invite you and hope that you will share it with your networks. Of course, the PHIRI team will also tweet about it and have it on our websites, but still we are proud that we will do something on the upcoming European Public Health Week on 20th of May. This is something you could take note in your calendar perhaps. We also will do something at the European Health Management Association website, so conference. So if you go to Brussels in June, make sure you attend our session. And of course, there's a lot of plans for PHIRI in the European Public Health Conference in November. Last and final one, please. Yes, what I said, we are really trying to reach out to other stakeholders. We had a very good cooperation, I think, with the Prepare cluster already, and this is excellent. There's so many, you know, institutions and networks working on this. And I think PHIRI could be the network of networks a bit. Our job is in the Rapid Exchange Forum, as the name says, to be a matchmaker, knowledge broker. And again, you're warmly welcome to join us. Thank you.
Thank you so much, Claudia. Yeah, I think this is really important, and we talked about it already many times, but being the knowledge broker is so important. I think it's important that we, as experts across Europe, sit together to know what kind of definitions we're using, to see how we're doing and having certain policy measures in one country compared to the others. Because, of course, COVID is one of the best examples to show that we really need to work across countries, and we need to work together to be able to address it in a coherent way. And also here, we are very pleased to see that our Rapid Exchange Forum is something that is actually very useful, that people are using, that decision makers are relying on to get information from a bottom-up approach and quickly as well. Also, we have the pleasure for the CDC to be in all of our meetings and also having questions forwarded to us, for example, from the WHO, from the OECD. So you can really see that what we are able to provide feeds into the scientific and the policy world. Yeah, well, let's keep up the good work, and thank you again for all these people that are participating in this Rapid Exchange Forum and that dedicate specific time to provide us the answers from all of these different countries across Europe. So now we will go to the PHIRI use cases and the federated research. I will pass the floor to Enrique Bernal Delgado from the Institut Aragonés de Ciencias de la Salud. So it's a pleasure also having you here today live, and he will be talking to us about the use cases and the federated research analysis. Thank you so much.
Thank you, Petra. Very nice to be here with you all, and greetings to those online. I'm today talking of a joint effort between work packages 6 and 7, so on behalf of Martin Thyssen, and the group in the Institute for Health Sciences in Aragon, the Biocomputing Unit, Juan González, and also the close collaboration of the University of Swansea, Ronan Lyons. So, this is not working. Thank you. So, just an overview, another click please. Yeah. So, as mentioned earlier in the morning, this is a twofold objective we are pursuing with the Work Package 6 and 7 is not just to respond to relevant questions on the impact of COVID-19, but also to test the actual infrastructure, the technology that allows us to mobilize extensively data that exists and is collected in a routine manner in different hubs, we call it, different nodes, in the that are part of these PHIRI projects. So a lot of institutions across Europe. So both objectives are being covered within both work packages 6 and 7. And what we're doing over the months has been to formalize 4 research questions for the 4 use cases we are referring here to understand what have been the impacts of the COVID-19 crisis on the most vulnerable population, for example, how it has impacted in the delay of the treatments on breast cancer patients. Also, it's about the impact on perinatal and maternal health, and finally on mental health. So these are the 4 use cases, and the effort made when mobilizing the data has been to provide a technological infrastructure to keep the principles of security and privacy by design, meaning that the data, as Petronil mentioned earlier as well, data is kept in the data hubs under the control of the data controllers or data processors in each of the nodes. What it moves is actually the software, the scripts, the algorithms that we contain in a Docker solution. So next slide, please. But this has been a stepwise process, starting from understanding how data hubs were equipped. In terms of both the access to the data, the actual access to the data, and what were the capacities they had in terms of the technology. Not just the infrastructure they own, so the hardware they have in their own premises, but also the technical capacities to deploy the solutions provided by Workpacket 7. So in the first round survey, we tried to figure out what were the capabilities in different. In the second round, please, next slide. Yes, yeah, thank you. It actually was to understand whether the data they had were compliant with the research questions formalized in a common data model. So 2 surveys conducted to understand whether it was feasible or not, respond to those 4 questions, research questions, across different nodes in Europe. Next slide, please. In this stepwise process, we ended up knowing the capabilities of 20 data hubs. And actually those 28 are potentially those that will be mobilizing data at some point in time along the project. So our participants, as you can see in this graph, some of them are participating in all the use cases, A, B, C, and D, at the bottom right of the slide. Some others are just providing data or are trying to mobilize data to respond to 1 or 2 of the use cases. But in the end, 20 data hubs actually have a commitment to try to mobilize data to respond to queries that I mentioned. Next slide, please.
You can try it to work.
Can try myself?
No, okay. Yes. Okay, it works.
So the second point has been to understand whether it was possible or not to deploy the technological solution in how many places. And we've discovered that at this point in time, which is not the final picture, I'm positive, but at this point in time, up to 13 actually, we knew yesterday that another one was able to make it. 13 data hubs, 13 nodes, 30 countries, institutions in Europe have been able to deploy the technological solution in their own premises. This technological solution is published already in Synodo, so you can all download it and test it and actually provide feedback to be improved. So I will invite you to do it. The next slide, please.
It should work now.
Should it work? No.
Yeah.
Yeah, you did it.
It's me.
It's me.
There's some delay though.
Yeah, it's a bit slow.
It's good. So maybe the batteries. So the next point is that once we know that all these data hubs, 13 as I said, not 12, have been able to deploy the Docker in their own premises, they are now running. So getting the data out the data sources. The process they are following right now is to actually transform the data sets they do have to be compliant with the data model. So there is interoperability across all the nodes responding to the same question. And very likely we'll have results. We are getting already results from some nodes. We will getting results for each of the use cases before summer. By the end of May is our provision. So this is how it looks like the results. So these are real results. Actually, we are seeing the evolution of a number of questions over the time, 50 different years. In some of the questions on was the vulnerable population. Use case A was actually part of the presentation made in UFA last year. So they are conducting now the analysis in the end using the Docker solution. Is working, and now it's working very late.
It's just slow, it's just slow.
What we've done, this is so the mobilization of the data. What we've done, particularly in Work Package 7, has been to support all this process. So we built the, let's say, designed the prototype. The prototype is this, what you see here, this graph in the end represents the stepwise approach required to be compliant with the whole process. From scratch, we do have an interesting research question on COVID impact. We formalize it using a data model that will be common once discussed with the different partners participating in this use case. Will be common to all. Then we will be developing central hub in Ajax in Aragon, developing the analytical algorithms, the data quality analysis that will be contained in the Docker solution. We will prepare the Docker solution. This is the interface that you can see when deploying the Docker actually on your laptop, on your premises, whatever the premises mean. And then you run, you see those 4 elements there are the 4 use cases already present in the Docker solution. So what we've done in the end over these months have been to formalize the whole process to make that interoperable at legal, organizational, semantic, and technological. Okay. What's next? Well, in the end, what I mentioned already, all the hubs are trying now to mobilize the data and to run the analysis using the Docker solution deployed. In some cases, we are keeping bilateral meetings with those who are not able yet to implement, just to know if this is for technical reasons, if this is for a problem with the access to the data, or what the problem could be. So to help them to join the process as the others have done. For that, we have set up a developers forum. This is a forum where all the IT people and some domain-specific people in the different hubs meet to understand the processes and the difficulties and to solve it. Has been one of the interesting assets of this project actually, because this is one of the elements for PHIRI infrastructure to be sustainable in the future. A small hint that could be probably be a good approach for the future will be mapping to a well-known standard of semantic interoperability as our OMOP. We are then mapping in this coming months the 4 common data models in the 4 use cases will be mapping to OMOP to see what are the advantages, disadvantages, and whether it could be sensible to actually provide insight to OMOP to enrich the OMOP model, because it's a big one to be used when mobilizing data and observational studies of any kind. And then we are starting a process for the upgrading of the research infrastructure. So the model, the pipeline that you've seen materialized in the Docker solution has been now under the reflections in the Sano group and IX group to see how we should upgrade it for further services. For example, now we are communicating via email, so we are providing the Docker links to the data hubs for them to deploy it using the email. And then they provide us back, but via email as well, the results, for example. This is human to human, although there is some technology there, which is the email. But then how to make this matching machine to machine. So this is the one first approach, so make it that automatic. So this allows in the future, for example, to build things that are synchronic instead of asynchronic, as we are doing in this exercise. How to distribute more complex algorithms, so not just to respond these questions, but respond more complex research questions. For example, observational intervention studies, or even federated approach, federated learning, so artificial intelligence in the end used to respond some questions that could be of interest, for example, predicting the outcomes of a population, and then designing the future of the computing solutions, hardware and software that could enhance this FHIRI infrastructure. So this is the work that we'll be doing with, along with our colleagues in Sinsan. And that's all from my side. Thank you very much.
Great, thank you so much, Enrique. So yeah, I think also what's something that's very important is that the future, I think, will be very much working in a way of federated analysis. It has become more difficult for data to move from one organization to another within countries, but also for data to move outside of the country. And if we want to make sure that we're able to do research, it will be very important that we will be able to have access to the data. So I believe in some fields, federated analysis is already something that is quite developed. But in our world, I think we need to move more into that direction. And of course, there's many different ways of doing it. And I think by being in PHIRI and implementing it, we're taking really important steps. And this has also, I think, has been noticed and is one of the ways that we can move forward with the European Health Data Space. So the European Health Data Space too is also looking at enabling secondary use of health data across Europe. And we've been quite active in that field as well. Also with towards the European Health Data Space joint action, we have been talking about how to be able to use these technologies and to optimize them so that data can be shared between countries, as this is really essential for the future as well. So yes, we're very happy that we're able to test this. It's not an easy exercise because I think what we're still finding difficult is to have this broad knowledge of what it actually means to do federated analysis. We need data engineers, people who know about public health and who know about these technologies and how to implement it, which is not easy to do. So I think also here there is a lot of work to do to strengthen the workforce across Europe in public administrations, in universities, but also in other organizations to be able to allow us to do this kind of federated analysis and to really strengthen our knowledge in that area. But as I said, I think this is the future, and we need to be able to adapt and make sure that we configure to our changing environment around us. Okay, so then we will move to the next topic.
I don't want to disturb, I mean, the flow of your meeting there, but I think for me it's a nice occasion to learn a bit about this, especially this federation approach. We had many meetings, exchanges. Sorry that I missed this exchange format, exchange forum that I also would like to know more. I have a few questions maybe I can ask you afterwards. There's one about this, I mean, what of this federation approach, all in view on the future, what to maintain as an infrastructure there, what has to be kept centrally and what is sort of done locally there. So that would be nice if either I can ask now or later, whatever is appropriate.
We have a couple of minutes, but let me just introduce you first.
Okay.
So this, unfortunately, maybe we need to move a chair a bit closer to this side, or maybe Mathieu, if you can switch with Andreas, because then we can see him on the screen, because the camera does not allow.
I don't need to see.
Yeah.
I haven't done my hands.
Okay, so it's Andreas Hultel, project officer for the PHIRI project, who was just asking a question, and I'll just repeat it so that everybody hears it, but normally the sound should be fine. But the question was, what are the elements that can be centralized and what are the elements that are federated in such an infrastructure? We have a bit of time, so no problem for you to.
And I mean, very, very concretely, this Docker, for example, is it an agnostic Docker so that gets locally charged by anybody and then sent off, or is it something that you centrally do? That was one question, what is centralized, and then this data processing. Using this federation approach, is there any sort of step where you locally still aggregate data, as they do in Finland? I heard that, I mean, this federation still has a data pooling at one sort of semi-local part there. So that would be the two questions.
In the data life cycle, you have steps, different steps. Some of them should be recommended, kept in the local premises, and should be done always there. Is about the actual mobilization of the data integration services, for example, the linkage, whether the data should be pseudonymized or anonymized, depending on the research question. You can opt for one or the other. The type of transformation required. All these elements should be kept and out of the Docker solution. But the Docker solution is one solution. So you might keep that and then open a secure process environment somewhere in Spain or somewhere in Finland. Because, for example, in the big high performance computing settings, I can remember the acronym in North CSE or BSc or even in the Japanese one, if you want, they can then have centralized services for the whole federation. So the Docker is just a solution that covers very well the compliance with GDPR and the local regulations. And this is let's say a mid-size approach. You can use Dockers to respond many things. And centrally, you can also have the coordination of something, but centrally doesn't mean necessarily just one place. So those well-equipped, let's imagine that Sinsano, for example, has the capacity to deploy, or Swansea University has the capacity to deploy some algorithms that could be used elsewhere. So someone could have the Docker, the preparation of the Docker, someone could deploy the algorithms. Still, the data keeps, local. Mm-hmm. So, the point is, trying to figure out in each step in the data life cycle, from the data preparation to the data use, what should be done centrally and decentralized. In any case, the data as such should be kept decentralized. The rest could be either centralized or decentralized.
I have one last little question. This OMOP, that is something normally mostly used with industry players also and in this field there. So, have you sort of done a survey and then you agreed to sort of try this mapping onto OMOP there for all use cases? Or is that so prominent now that this is the way to go anyway? Because a lot of discussion always on the data model.
Well, it's a formal standard for observational studies that came up from the domain of pharmacoepidemiology. And it's an open community, it's very, very vivid, and there are many developers. They have actually, it's not just OMOP as the common data model, but also it's about the search engine, the mapping to different taxonomies and ontologies, the interaction with other big standards, for example, FHIRI or for example, LOINC. So there are a lot of advantages of being part of that community. It's not just because of the common data model. And we know that that common data model well fits into the pharmacoepidemiological studies. So for example, EMA should be very interested in using it. It's not that clear for many other research questions in the realm of population health. Okay. So we have to test that, because being part of that community may be a good asset. Being part means not just taking advantage of the products and the community itself, but also provide them insight, to be inside in the process. So testing that is sensible. I wouldn't say, well, this is the only one, or this is the only way to make things, but could be sensible to understand what we can get out of that and we can provide them with. This is the approach, actually.
Okay. Thank you so much for these answers, Enrique. There will maybe be a bit more time at the end as well if there's more questions, but also to the participants that are joining us virtually, please don't hesitate to put your questions in the chat so that we can address them. The next topic is research methodologies. So our colleagues have been working really hard on doing extensive systematic reviews. So I will pass the floor to João Forjas from the Instituto de Saúde Carlos III. Over to you. Thank you.
Okay. Thank you very much. I'm Jean Forjas. I'm here also as a co-team leader with Paulo Nogueira from University of Lisbon, and I'm from the National Health Institute Carlos III from Spain. And I'm going to talk a little bit to you about what we've done on research methodologies to assess the impact of COVID-19. Good, it works. So what we want to do here is to support the European Union countries to understand the impact of COVID-19 on population health and well-being, and also on morbidity and mortality. And to do this, we actually have 4 aims. The first one is to map and synthesize the methodologies and the pathways of COVID-19 impact research. And here we're also doing some work on listing and finding out what are the impact indicators that have been used. Also, we want to explore the determinants of severity of long-term health outcomes of COVID-19. We're interested also in mapping the digital tools that are available and what innovative solutions have been using to address the pandemic. And finally, we want to pass knowledge to others by building capacity on impact assessment in COVID-19. So these are the 4 main aims, and I'm going to explain each one with a little bit more detail. So for the methodology and data pathways, we have established a protocol, a literature review protocol, and we have uploaded that protocol and it's available for everybody. I must say that the protocol is a roadmap. It's something that you plan to do, and it's always changing. So we will be uploading new versions of it as we take decisions. We have sought about a little bit more of 4,000 titles and abstracts. After removing duplicates, we had almost 4,000, 3,891 that was screened. That was the work done in January. By March, we had retrieved 7,200 articles about impact indicators. Each article actually offers and reports on between 1 and 15 indicators per article, so you can see it's a lot of numbers. And those numbers really add up fast. And finally, we are working on a little bit over 4,000 articles contributing to health indicators of direct impact. And later on, we'll do the work also for indirect impact. Right now, we are extracting the information about the indicators. And for this, we have developed an online form to collect these indicators. So far, we have 77 different impact indicators that were reported. Okay. For the data pathways and methodologies, you can see that's a very broad concept. So for this, we have the team from Portugal has identified about 20,000 records, and they have screened about 80% of them. That's 16,000. On the roadmaps and data pathways, we have drafted a version of the report in October 21. We have built a team of 13 researchers that have been trained to do these systematic reviews. And we have managed to use some specific software such as Ryan, and some preliminary results that will be presented both in UFA and the Spanish Society of Epidemiology conference, is that we have identified, in a sample of 35 papers, we have identified 116 different types of indicators. 28 are related to mortality, so that means there is 28 different ways of calculating mortality for COVID. Morbidity, I mean. 32 for mortality, 54 for severity. In their actually composite indicators are very little used, or we only found 2 for severity and mortality. About determinants of severity, what we wanted to do, and this is the French team is doing this with the collaboration of other countries, is to assess the etiological role of frailty, multimorbidity, and socioeconomic status on the risk of short-term COVID-19 outcomes, and that's infection, hospitalization, ICU admission, mechanic ventilation, or death. And we're also looking at the prognostic value of these determinants in long-term and short-term impacts, such as functional decline, quality of life, mental health, survival, work absenteeism. So far, what we've done is, okay, this goes, yes. We have explored 4 different databases, Embase, PubMed, WHO COVID database, and PsycInfo. We have retrieved 10,000 titles, and out of these, 400 articles were read in full text. And we found 16 studies on multimorbidity, 3 on frailty. Actually, I was impressed by the very low numbers of papers on frailty. And if you think frailty is usually associated with older adults, and the older adults were the ones that were most impacted by COVID, but only 3 report data on frailty. And 87 report data on socioeconomic characteristics. So it means that right now the scientific community is actually very aware and gives lots of importance to socioeconomic differences and the impact by socioeconomic characteristics. We've evaluated the studies, their quality, and we're right now extracting the data, separating information by objective, risk factor, and outcome. The protocol has been uploaded and actually recently sent for publication. We've seen that there's much less evidence for biomedical risk factors such as frailty and multimorbidity compared to socioeconomic factors. The short-term outcomes are actually, such as death or ICU admissions, are the most often identified. We've also learned that multimorbidity mainly observed through the disease count, not severity, but the disease count presents worse outcomes with people having a higher number of diseases have a worse outcome. There's very little information on frailty, and so that's an open field for further research. And we also observed that there are worse outcomes in people who have low socioeconomic groups and low educational levels. So the third goal was to see the efficacy of new digital tools. And for this, we did 2 approaches. We're using systematic reviews, but also a survey on digital tools. So for the systematic reviews, there are about 8,000 records that were retrieved and assessed, and finally we've included 58 full texts. And for the survey, what we did was the Italian team did a survey on innovative tools that included contact tracing and monitoring and warning apps, and digital tools that we're using for diagnostic, treatment, and vaccines, and also online platforms to fight disinformation. And this survey was sent to the PHIRI country participants between December and March, and 16 countries responded, and actually have 19 complete surveys. And this data is now being assessed. Okay. So the first results show that there are population contact tracing and modeling studies with real-world data, with hypothetical data that compare different strategies, that compare no intervention, lockdown, social distancing, without contact tracing. So this has been done, it's possible through digital tools. It also shows us that digital contact tracing is effective. and its effectiveness has been demonstrated as showing that there's lower contacts of confirmed and suspected cases identified. It also reduces the effective reproduction number or the number of infections. Of course, data will change a little bit from country to country in the way that contact tracing is implemented. And the results from the survey we're analyzing right now and will be available in the incoming months. Okay, I think, okay, there. And for our fourth goal or aim was capacity building exercises. For this, we have already done a webinar in February in Lisbon about digital and innovative tools, the challenges of contact tracing public health. That was an online seminar. And then just last week, we were in Ljubljana and we organized conjointly with the Cost Action about European burden of disease. We organized a 3-day training school, COVID-19 burden of disease training school in which we have over there the photo. We had about 27 participants and 3 trainers, and actually I was able to participate, and I can personally speak of the high quality of training that was provided over there. So with these 2 new experiences, we want to expand them, and we are planning 2 new capacity building events that actually were not planned in the beginning, but now we feel we have something to say and we can pass the knowledge that we've been gathering. So we will do a workshop on systematic reviews, especially for the PHIRI partners, and also we want to do a workshop on COVID-19 impact assessment that will be open for PHIRI partners and other interested parties. And that's it on our behalf. Thank you very much.
All right, thank you so much for this extensive and thorough presentation of what we've been doing with regarding to research methodologies. And also here, I think this will have a clear added benefit also across countries because, for example, the HERA is being built, and here to be able to monitor on a longer term and being prepared for future crises, it will be important to have sets of indicators we can use to monitor also COVID for the longer run. This will be important to be able to have a long-term strategy, I would say. So I think these indicators that will be found will be quite instrumental to be able to do this. Okay.
I can ask one question.
Oh, sorry.
Many thanks for that. I mean, this sort of doing systematic review, is that something you envisage as a sort of service of the infrastructure in the longer term? So somebody can come and ask that consortium here to use whatever setups you have there to do a certain systematic review on demand. Is that foreseen, or is it generic training or doing?
Yes, that's why for us it's so important to publish our results, so that they will be available to the broader scientific community, and also by generating ways of doing it, and that will be the capacity building exercises, so we can.
So my question is really, are you doing capacity building, or are you developing a service of an infrastructure that people can use later for if they have a need for a systematic review?
I think it's the first case.
The first case.
Yes.
Okay.
Yes.
Okay, there's a short question in the chat as well, which was asked by Simon Bielecki from the Commission. The question is, whole genome sequencing has been mentioned. Can you provide more information on the question asked with regards to whole genome sequencing? So we'll answer this very shortly, and then we'll move to the presentation.
Thank you, I'm happy to answer that. This topic was raised in 2 of these rapid exchange forums, especially in 2021. And it was, one was related to the Omicron cases, so the question was if the cases were really confirmed. So we had a round on how many confirmed cases were like a Delta version or were Omicron version, and were even in a more detailed level. So this is one question we had.
Okay.
And if there is need for more information, we also had it already in the 11th forum, but it's quite a while ago in spring 2021. But I will have a look at the minutes from that.
Great, thank you. We received your email address, so we will share additional information at a later stage. So now let me pass the floor to Henk Hilderik from the Rijksinstituut voor Volksgezondheid en Milieu from the Netherlands. He will be talking to us about our activities in foresight, modeling, and scenario building.
Okay, thank you very much. I will take you a little bit about the progress that we made in Work Package 9. That's called Foresight and Modeling and Scenarios. And actually something that we learned the last 2 years, how we were not prepared for the future actually. And a tool to do so is to apply public health foresight. And public health foresight is a systematic way of looking to the future. And actually it also should support present day action. So that is really important that we make the link to, let's say, the policy making. So next slide, please. If we apply it actually to the COVID-19 pandemic, then we see that we want to have a better understanding of the future. And that means that we are looking at direct effects of the pandemic, but even also, or more important sometimes, also the indirect effects. Then we're talking about mental health, we're talking about changing lifestyles, the long-term effect of reduced healthcare provision. And actually it should be a basis for policymakers to act based on the future that we are more or less trying to explore. Next slide, please. How do we do it in PHIRI? Actually, our main aim is to support countries in doing their own foresight study. So that is really rather ambitious, but actually that is something that we really foresee that should be, let's say, the ideal situation within Europe, that countries are able to do the public health foresight study. And to do so, we had 4 different activities. We had first an inventory of foresight activities in Europe and beyond. We did some foresight capacity building. Then we want to also support countries in developing their own scenarios. And what I said, identifying the promising policy strategies that could be put in place in different countries. How can we learn from other countries? I will go in depth a little bit on these 4 aspects. But first, we wanted to see what is already happening in Europe on foresight activities. And we did a survey and we did desk research, and we saw that in many member states there is some foresight activity going on. However, what also was rather clear that in many countries there was a basic need of the understanding of what is foresight, how can we apply it. And then it's talking about data, methodologies, but also about advocacy of the tool. And there was also clearly a need for a professional network within the project, and that's something that we started. So based on this, next slide please. Based on this, we developed a foresight course, a public health foresight course, that addressed, let's say, the basic level of doing a foresight study. What is it all about? The introduction. But also we had 3 more advanced modules going into the process, but also the participation of stakeholders. How do you do that within Europe and within your country? We looked at what kind of data do you need, what kind of methods do you need to do a foresight study, but also, very important, what kind of products and communication strategies do you put in place? So the reporting and implication for policies. We had 24 member states that were participating in the course, about 15 to 60 participants per module, so we had quite a nice reach of that. And it was a mix of lectures, exercises, but also examples of within Europe how people are doing foresight studies, or for example how they do a stakeholder participation process, which is rather important. So, and then the third step is that we want to support countries, first to stimulate them to do their own public health foresight study, but also support them to do the scenario development. And to do so, we had developed a template that is guiding the countries through the different steps of doing a foresight study. We have also written a compact guide to do a public health foresight study that's linked to the template. And there you can find all the explanations of the steps of doing a foresight study. We have now regular sessions of different countries doing their foresight studies, but we also offer tailor-made sessions to go in depth into a country application to see how we can be of support, helping them to do a foresight study. And actually the idea is that we at the end have a better understanding of what are the key uncertainties and challenges that we are facing in the coming decades. This is an overview of the studies that we're doing, and you can see there's a nice diversity of topics and also a nice diversity of countries involved in doing the foresight studies. It is a bit of, let's say, the NCDs, the non-communicable diseases, but also mental health plays a role, long-term care. So you can see that it's covering quite some topics. It's also good. Some countries are participating more as, let's see, how can we do a foresight exercise within our country, and some are really doing that as they want to also implement it within their country. Next slide, please. And the last point, I cannot stress that enough. We are doing a foresight study not only to understand the future trends, but also to translate the knowledge that we achieve to the policymakers that is being used, let's say, for policymakers to implement the promising policy strategies. And especially here, the exchange of countries, let's say the exchange of what is a good policy strategy, but maybe also what isn't a good policy strategy is rather important. So that is helping quite a lot. And also we want to stimulate the policy dialogues also to see how can we further develop foresight studies that it can be better interact with policymakers as well. At the end, we want to produce some fact sheets focusing on different topics that will have some recommendation for policymakers. Thank you very much.
Excellent, Hank. Thank you so much. So I think it's really clear. It's not only about capacity building, but it's also about really developing foresight studies in countries and being able to use them afterward for policy making. So it's really nice that we managed to bring all these three things together, actually develop our knowledge about doing foresights, making sure that different countries are able to carry it out and support them in doing the exercise. And the last aspect, making sure that also what is being done in these foresight activities can be taken up for policy and could be really of use in practice. I will take your question very shortly, Andreas. Thank you so much.
I'm very sorry that I've come with this. I think unique occasion sort of to make you fit for our program there, I think, because you come from health, from Santé area there, so there's a lot of these by country approaches there. So you do this foresight studies per country, so you enable countries to do that. First question is there any sort of need to do foresight studies across countries there? That makes you more fit for our EU level support. And the second question would be to focus on the service delivery. So rather than the same question I had before, just to do this training and enabling in order on the longer term, now we have 5 million, you cannot do everything, but to have think of a service that you can offer there as an infrastructure. That is another raison d'etre for funding such a thing.
Yes, regarding your first question, thank you. We as RIVM, we're doing foresight studies already for more than 30 years. And we really hope that it's also being brought across Europe, and also that we are using the knowledge that we have, that it's being translated as well to other countries, that we can do foresight studies as well across Europe. I think that's a very good ambition level to strive for. Secondly, yes, we are looking into options to offer what we have done as a service that we can, let's say, regarding sustainability, that it will be after PHIRI or next to PHIRI or in whatever form that we can offer it as a service. But we're looking into the options for that now.
Okay, thank you. We will move on to the next presentation, and in the meantime, there's a question for you, Joao, in the chat, so if you could move to Ninka or someone who's connected in the meeting, you can take it by the time. So now we have the pleasure to have Miriam Sazo from Cienzano, who will be presenting our COVID-19 Health Information System Assessment.
So thank you very much, Petroniel. Indeed, today I will be introducing you to the COVID-19 Health Information System Assessment activity we are performing within PHIRI. The aim of this exercise is really to map the COVID-19 Health Information System that monitors the effect of COVID-19 on population health. So we really want to find out what was in place before the COVID pandemic hit and what had to be implemented in order to support the data collection and the data analysis during the pandemic. At the same time, we really aim to create capacity both in the different countries, so by training the different assessors to perform semi-structured interviews, but at the same time, we are really creating connection in the different countries that we are assessing by learning to know more about their health information system. The tool that we have been using is a very extensive WHO assessment tool we have adapted in order to cover the COVID-19 aspect, and the major blocks that this assessment tool contains focus on data collection, data analysis, reporting, knowledge translation, and governance and research. So just to briefly show you how the assessment is constructed, so the process. First of all, we prepare a preparatory desk report to really get to know more the basic about the health information system of the country we're assessing. And at the same time, we talk with the counterpart in this country to really identify the key stakeholders. So we're really interested in talking with probably the Ministry of Health, the Public Health Institute, the Statistics Office. So we really talk with the counterpart that we have in the country to identify the key speakers and plan the interviews. Then the second point is to contact the different speakers and to have interviews. We usually try to have them multiple interviews in around 3 days so that we can really combine all the information in a short period of time, but of intense days. And we have tailored interviews with usually between 6-7 speakers. It really depends, using the WHO assessment tool that I mentioned. Then in the third step, we produce two main outcomes. One is the one page that really summarizes the key findings of the different assessment with some best practices and recommendation. And this one page will be available for everyone, so within the PHIRI consortium, but also will just be able to share publicly. While the second one, it's a much more detailed report, and we really produce a SWOT analysis and smart recommendation for the country, where we really highlight the different strengths and weaknesses that we identified in the specific country. Finally, we want to meet again with the stakeholders. So one is just a tailored meeting to the stakeholder in the specific country to present the preliminary results. And the second one, after probably 5 or 6 assessments, we want to have a plenary session where we highlight some of these key findings. Just very briefly, for the moment, we have performed 2 assessments already, one in Italy and one in Portugal, and we really were able to identify some best practices. For example, for Italy, we learned that just before the pandemic, they were able to invest on vaccination systems. Then this new system that they have developed really helped them a lot during the pandemic to be quick and answer to the challenge of producing vaccination certificates and link them to the different citizens. Then on the other side, in Portugal, we saw how rapid they were during the pandemic itself developing different health information system, like the technical part, how quick they were to reply to the needs of the country. On the other side, as concerned, we really identified that many countries, they could collect specific COVID-19 data based on the emergency state that they had in their country, but these pose big challenges the moment the emergency state decree is revoked in the country, because these leave a lot of data that was collected during COVID with some uncertainty. So does it need to be destroyed, or can we still be able to use this data after the emergency situation is over? So this is just a little bit of an overview of the assessment we have already planned. So in April we will be assessing Ireland, while in May we will focus first on Norway and then Malta, and while in June, July we will be assessing Hungary. After summer, we have other 4 countries that are very interested in being assessed. We have not planned the dates yet, but we will definitely get back to them, and we'll be trying to perform the assessment towards the end of 2022 or the beginning of 2023.
Great. Thank you so much, Miriam. We will be probably 2-3 minutes over time, so I hope all of you will be able just to stick with us a tiny bit longer. But our last speaker, last but not least, is Louis Lapal for capacity building. When we designed the PHIRI project, for us it was really important to have capacity building actually in each of our activities, because we really believe it's important to be able to not only address inequalities, but also share the knowledge and expertise we're building up in PHIRI straight away. And so Louis will be talking a bit more about these capacity building activities. Thank you, and over to you. Ninka will be sharing the screen, so just give her a second and we will bring it up.
Morning, everyone. It's nice to be with you today from Lisbon. It's a very nice day here. I hope it's the same in Brussels and around Europe. So I will present very quickly what we have been doing regarding training materials and courses for capacity building. We have been pretty active since last meeting. So we have finally the capacity building on site, so everyone can look at it and actually make it as a one-stop shop for capacity building and health information in Europe. We are also trying to engage more partners and work with the PHIRI work package leaders to make it more strength and keeping updating all the information regarding capacity building of health information in Europe. And also searching for new partnerships and developing new training courses. So as Anna already mentioned, we have been working hard on having a catalog, a standardized template for metadata, so we can all the information regarding capacity building in Europe will be organized in a structured way. And the activities we already collected in the site is pretty comprehensive. Already 143 activities regarding capacity building in health information in Europe. I think it's very relevant and counting. So we have covering aspects like topics, organizing country, activities related with COVID-19. And we also see that our work package are very active. Congratulations for the teams that are working hard to promote the training, as well as keeping doing their own work on their areas. And we are keeping, as I said before, we are keeping updating almost every week and collecting capacity building from the work packages of PHIRI. And but now the most important thing is to make sure the next year we'll have a comprehensive European School of Health Formation as an annual program, collecting previously all the information that will be of the courses that will be provided in the next year, so the people can see beforehand and make decisions and organize and planning for the next year, and making sure that we are also contributing to this one-stop shop for capacity building in Europe. And this process of engaging other partners is very important. So far, we have already with us the ACDC, which is a very important partner and doing a great job also on capacity building, really a relevant reference in terms of capacity building in healthcare. And as João has pointed out before, this is one of the previous courses organized within PHIRI with a huge success, bringing people from around Europe and contributing for tackling the inequalities in accessing to health information and capacity building. But we also call you to be attentive to the next events. Go on the health information portal and look at capacity building. For instance, we have this next event who will happen in May, and you have until April end of April to register. And we are also working on the Autumn School of Health Information that we organized between October and November, and the call will be issued in the next June. Thank you very much for your attention.
Thank you so much, Luis. That was very brief, but I think it covered a lot of the things that we're doing, and it's very exciting also to be able to very shortly share that. So that being said, I think we covered in an hour and a half, very shortly, all the things that we're doing. We will be repeating this so that you can keep in touch and see what we're doing. For the partners of PHIRI, please reconvene at 11:30. So this will be another link, but we have our General Assembly where we will be talking about financial and administrative aspects. For those who are not part of the consortium, thank you so much for joining today. It was really a pleasure having you around the table. We're very, I'm very proud of like the whole group and all the different activities we've been doing. So thanks a lot for the hard work for all the partners. And register for a newsletter to stay up to date about what we're doing. Look at our Twitter account and don't hesitate to get in touch with us at any time. Thank you so much and have a wonderful afternoon.